All right, that's the video from CISD team about the situation of tobacco tax policy in Indonesia. Just very briefly, I will continue with some presentations um, about the tobacco taxation policy and what we've done from the Indonesian tobacco control communities to help the government optimizing the tobacco tax policy to make cigarette price less affordable, especially for children of the vulnerable populations. Before that, I would like to greet everyone who just joined, including there's Pak Febri from the Ministry of Finance of Indonesia. Welcome, Mas Febri. Very happy to have you in the event. We would like to hear more from you after the session of a panel discussion with our speakers. So I will now start with a bit of sharing about tobacco taxation policy in Indonesia before we start the panel discussions with two of our speakers, Ms. Sasanka Dharmasena from Sri Lanka and Ms. Lindsay Orsolino from Philippine Department of Health. Let me just share my screen. Okay. All right, so I hope everyone can see my screen. So I would just like to share just a little bit about the tobacco taxation in Indonesia. And I think since today, the title of the event is again virtual coffee sharing with the APACT12 Youth Camp alumni. It would be, hopefully it would be interesting enough for all the young people and the young generations, because usually tobacco taxation is more of economic and a heavy discussions, but we try to make it as light as possible. So again, as all we know, tobacco use, major but preventable public health risk in Indonesia. And we still have a growing number of smokers, especially for the children smokers, who's actually, which number is actually increasing from 2013 to 2018. It was before 7.2%, and in 2018 we still have 9.1%. And the number is still far off the National Medium Development Plan from the Indonesian government office, who targeted the prevalence for the smoking children to be at 5.4% in 2019. So there are still homeworks to do, in that including the optimizing for the tobacco taxation policy. So cigarette is still cheap in Indonesia. We can still buy it per stick. It's still sold and promoted almost everywhere. If you see the picture in here, this is a retail shop, which is very common that you see in a street in Indonesia, where children can just come, and it's sold near to the daily needs like shampoo and soap and other daily essentials. And the promotions actually say the price of the cigarette, and it's actually say the price of the cigarette is only 1,000. So the advertisement actually pointing the affordability of the cigarette by sticks that they are selling in this small retail price. So even though the Ministry of Finance already trying to increase the cigarette excise rate almost every year, but if we see the affordability of the cigarette price, that raise in tobacco tax is not significant enough to reduce the affordability of cigarette. So that's basically what this graphic is saying, that the affordability, that cigarette is more affordable for the Indonesian consumers every year, because the increase doesn't balance the capacity, the consumption capacity of the Indonesian consumers. and that will also including children smokers. And other than that, we still have one of the most complex tobacco tax structure in the world. We have 10 tiers of excise tiers. And what does that mean, right? 10 tiers of excise tiers. So as a result of these complex structures, we have a variety of cigarette price in the market. So some brand, they might sell it for a higher price, but the other brand, they may sell it for a lower price. And that including for the major brand. So doesn't mean that the major brand will always sell in a higher price, but there's actually a very major brand of cigarette that still sell their cigarette in a very low price that is very affordable to the children of the Indonesian population. And the complexity of these structures also allows smokers to switch to a cheaper options every time the Ministry of Finance try to increase the cigarette price by increasing the tobacco tax every year. And this also create an ineffective excise tariff increase. And it becomes also another complexity for the Minister of Finance, especially for the administrative part, because there's a lot of problems in the illegal tobacco excise tax that become an issue in Indonesia, and some of those also caused by this complex structure of the excise tiers. And another issues is because according to the law in Indonesia, the tobacco companies actually have to be involved in the decision-making process. So you can imagine that we are trying to regulate the most harmful product, but the producers or the company who sold that products must be involved in the regulation. So it creates another complexity to actually make ideal regulations to optimize the tobacco tax policy in Indonesia. Like for example, when I was talking about the tax simplification the tax structures, the Ministry of Finance actually already tried to have simplification regulations and already have a very well-planned roadmap to have the tobacco tax structure less complicated and more simple. So it's a simplification policy in 2017. But then the policy was being on hold because there's a very strong protest from the industry. And again, because the law said that the tobacco industry must be involved in the decision-making process, it creates hurdles for even the governments to make a stronger policy for the public health. And of course, there's been a lot that we have tried to do to push for optimum tobacco tax policy in Indonesia. And advocacy efforts come from NGO, academics, professional organizations, and including from the government itself. So this is the picture of Ibu Sri Mulyani, who is our current and previous Minister of Finance. And she is also with our former Minister of Health, Bu Nila Muluk. And this is the event in the youth event that's also organized by CHISDI a few years ago. So what CHISDI have done, well, other than doing the advocacy events or efforts, We also provide scientific evidence, and it's not just CISD. Also other organizations in Indonesia, including universities, the National Committee on Tobacco Control, and other groups who are really cared about public health issues and also the rights for children, protection, also have been voicing this issue to the government. And universities also working together with NGOs like CISD that works as a think tank to provide scientific evidence. For CISD itself, we already have two scientific evidence. One is about the negative impacts of high cigarette consumption to health, economy, and welfare. And also other scientific evidence provided from the tobacco control networks are the impact of tobacco excise tax policy to cigarette consumption, illegal trade, and again, the welfare of tobacco farmers and workers. And I think the last part is also very important to be highlighted because it's very common, I think, around the region and around the world that any tobacco tax policy are crushed or limited because the issue of tobacco farmers and workers that might not necessarily 100% related to the policy that we're trying to advocate. And we also have meetings and media briefings that also include Ministry of Health. We often have discussion with Ministry of Finance. Like in this event, we also have Mas Febri from the Ministry of Finance to join the discussions. And we also usually invite other like the national development agencies in the discussions to put on strategies and also to understand what is the big challenges of making tobacco price less affordable in Indonesia. And we also do public and media campaign. We use social media. We use YouTube. We try to make the discussion about tobacco tax policy as easy to digest as possible, because it might get too technical when we talk about tobacco tax policy, and usually it's the professors from the economics department who will put out their numbers and everything, but then we try to make it as a common issues for everyone to understand. We use comics, we have online social media competitions, and we also have a youth capacity buildings sessions and discussions to talk about what is actually needed or actually demanded for the Indonesian policy to be done. And that's including what does youth want? What is the voice from the youth? Because as we can see in my beginning of presentation, that the number of adolescent smokers, the youth smokers, are still increasing every year in Indonesia. And is that something that we as a young generations still want that to be the situation in our country? Hati-hati, hati-hati. Dukun panggil. Alhamdulillah. Apa lagi yang kurang ya? Iya. Suaranya kebangetan. Ajar bos. Yeah, that's just example of the video, of a parody video that the creative team from the CHISD has made. Because we really want to engage more youth, more young people to care of this issue and to discuss about this issue, and also to demand for a better policy for Indonesia. So this is our Instagram account, sebelah mata underscore CHISD. And we have more than 1,000 followers. After a year, we launched the social media platform. All right. And we also have a theatrical event, and we also have a talk show in media. This is one of the news media in Indonesia, Berita Satu. All this, you can access it in our social media Instagram account. Okay. So although the hurdles and the challenges from the tobacco industry in Indonesia, with their very strong lobby to weaken tobacco tax policy, but we would have the highest appreciation to our Ministry of Finance, who's been also fighting to optimize the tobacco tax policy, that including the achievement that we have last year, when cigarette tax was raised by 23%, and it was the highest tobacco tax increase in Indonesia. Before that, it was only around about 10%. Even there are years there's no increase at all. So we really appreciate the efforts, the collective efforts, not just from the NGOs, but also from the governments. But again, yeah, we are still working hard because again, we still need to have a tax increase, annual tax increase, including this year. And we hope also that simplification policy being implemented again after it's being held in the last couple of years. So there are still a lot of work to do, but we hope that Indonesia will have its achievement again with the strong support from all level of the stakeholders, from the NGOs, from the communities, and also like today, from the support from youth from other countries in the region. So that ends my sharing session, my presentations. And I would like to welcome two of our panel speakers. Ms. Sasanka Dharmasena from Sri Lanka. She graduated from Human Resource Management, but she is a youth activist and currently working at the Alcohol and Drug Information Center as a project officer. It's an NGO for the National Committee in Sri Lanka. And she's also actively working as a resource pool head in Youth Action Network in Sri Lanka. Hi, Ms. Sasanka. And our second speaker is Ms. Lindsay Orsolino. And she's currently working in the Philippine Department of Health in the central office. She currently works as a supervising health program officer, the executive assistant designate at the Office of the Secretary. She's a former health policy and systems research fellow at the Department of Health, handling several portfolios that include advancing tobacco control initiatives in the country. She provided technical and management support in the passage of several legislative efforts in tobacco control, which include the Republic Act or the Sin Tax Reform of 2019 and 2020, respectively. So it's been an honor to have both of you, Ms. Sasanka and Ms. Lindsay, in this panel discussion. We would like to hear more about the advocacy efforts and the situation in your countries. And maybe we will have some questions, and I hope that you could answer those questions, both of you. And after the session, I will also then invite Pak Febri from the Ministry of Finance in Indonesia to share his experience from the Ministry of Finance. What are the efforts that has been made to make cigarette less affordable in Indonesia? But now we will have the panel discussions with Ms. Sasanka and Ms. Lindsay. So Ms. Lindsay, Ms. Sasanka, I would like to ask the first questions about the situation in your country. Maybe you can share about the tobacco pricing and excise tax policy in Philippines. Maybe Ms. Lindsay, you would like to go first? Like, how much money do you need to buy cigarettes in your country? Is it considered as expensive, or compared to like other products, is it still considered cheap as well?
Hello, good afternoon, everyone, and thank you again for this opportunity to be sharing the experiences of the Philippines in terms of tobacco taxation. So for your first question is, how much money do we need to buy a pack of cigarettes in our country, and if it's already considered cheap or expensive, and what are the other things that we can buy amounting to that same amount of money. So a pack of cigarettes containing 20 sticks, this is the premium brand already, ranges from about 100 to 150 pesos. That's about $2 to $3 US. And the relative income prices of cigarettes in the Philippines is actually in an increasing trend. And this is because of one of the major reforms in 2012. It is the Syntax Law of 2012 that has made a positive impact on the increased cigarette prices. And this trend could also continue as the country recently passed reforms, increasing the excise taxes of tobacco products. So the first major reform increasing the excise taxes of tobacco products in the Philippines was in 2012. So last 2019, we recently passed a law, a legislation, further increasing the excise taxes for this tobacco products. So other commodities which can be bought by the money, the 100 to 150 pesos or $2 to $3, it could also be equivalent to about 2.5 to 3 kilograms of rice already, 1/2 kilo of pork, for example, 1 kilograms of chicken, which is really could already be a significant amount of money, especially in lower income households. So for the information of everyone too, in the Philippines, we have a simplified or unified tax scheme, meaning regardless if your products are quite not so in the we impose equal taxes to products whether it's a premium brand or not. So we have a unified taxation that makes regulation and enforcement easier. Enforcement of the taxes.
So yeah, would you still think that the cigarette price is very affordable, or you're saying that it become less and less affordable in Philippines now, Ms. Lindsay?
I think in my personal opinion, I think the prices is still relatively affordable as since the purchasing power of the people also increases as the years go by. So unless you really impose a very significant amount of taxes that can make people even from middle or the higher class incomes not afford that product. So that would really be the ideal situation. But then again, there are many considerations when it comes to deciding the tax rates which will be passed or which will be approved by the Congress or by the legislative bodies.
Okay. And for the percentage wise, what is the percentage of tax compared to like the global standard that keep on advocated by WHO of 70%? How much of the from the retail price is the percentage of tax in Philippines?
I think with the current tax rates now, the current tax burden imposed on cigarettes is about 55, an estimated range of 55.7% to 60%. So 45% is the excise tax burden plus 10.7% for the VAT burden. So in about that range.
Okay, okay. Yeah, we would like to hear more about the impact of the syntax policy that you've been saying. So maybe, but after we hear more from Ms. Sasanka about the cigarette price situation in Sri Lanka. Sorry, I think Ms. Sasanka, you're still on mute. Yes.
Hi. Good afternoon, everyone. First of all, I would like to thank CISDI to organizing this event and joining me. And in Sri Lanka, according to in Sri Lanka, Ceylon Tobacco Company is the monopoly tobacco in Sri Lanka. The tobacco industry in Sri Lanka is a monopoly. The BAT owns, British American Tobacco owns 84.1% percentage for the British American tobacco. Related to the other countries, in Sri Lanka, we have a good price for the tobacco. 25 stick pack is $8 in Sri Lanka. It's related to, according to other food and other things, it's affordable, still affordable to the young people for the tobacco. Apart from the taxes in Sri Lanka, currently we have good policies for the tobacco. Like in Sri Lanka, tobacco industry can't do any promotions and advertisements like that. But still we have a problem in taxes. The tobacco industry, the government has effectively controlled tobacco tax policy until 2005. But after that, there is some kind of problems in these tobacco tax policies. We found some evidence for tobacco industry influence Ministry of Finance to stop reducing prices and taxes because tobacco, when tobacco prices high, they face major problem for sell their products. But in Sri Lanka, we have several tobacco cigarette products, and some products are it's very cheap. Like in Sri Lanka is a developing country, and most of people are low income families. Then still we have some products, it's very cheap, and most of laborers and workers are using these products. It's very cheap, but gold leaf is the product most of Sri Lankan use, but it's that gold leaf is have some kind of good price in Sri Lanka.
So, Ms. Sankay, are you saying that for the price, it's already $8 per packs, correct? For
yes.
Cigarette price, and $8 per packs, and there are cheap products. Is that a tobacco products, other tobacco products, or is it also a cigarette product?
In Sri Lanka, we have mainly people using cigarettes, and the cigarette is the main product they use.
Oh, cigarette is the main products they use. Okay, and the price is $8 per packs, and is it possible to buy it per sticks?
Yes.
Yeah. Okay, so it's a shared problem that we also have in Indonesia.
Yes.
And you're saying, but the advertisement and the promotion is not allowed anymore in Sri Lanka.
Yeah.
Okay. Yeah. And BAT is the company with the biggest share, and they also lobby the Ministry of Finance to stop increasing the tax to make cigarette less affordable.
Yeah, yeah. Not only the persons who work in the Ministry of Finance and the minister of the finance and other ministers, they are I don't know, they are banned the bribe or something. They are talking. We found some kind of evidence for that.
Okay, and comparison to the percentage of the retail price, what is the tax imposed in cigarette in there? Is it already close to 70% from the retail price, the tax, the tobacco tax?
Not yet.
Okay.
Every year, Sri Lanka government has been losing billions of rupees over several years, which could have been incurred as tobacco tax revenue due to the irrational tobacco tax policy. Because the government lost approximately 100 billion rupees over the past 5 years because of irrational tobacco tax policy in Sri Lanka.
Okay. And when you say irrational, what does it mean?
Irrational means the persons who working for the tobacco prevention and they introduce a scientific method for the tax policy in Sri Lanka, and according to those that policy, but in Sri Lanka we don't have that kind of taxation and regulations for the price increased.
Okay. Okay. And again, compared to retail price, how many percent of the tobacco tax is it in Sri Lanka for each cigarette tax? Is it already, you said it's not 70% yet, but can you give us some numbers, how many percent it is right now?
I don't have a proper idea for that.
But it's also not 70% yet.
Yes.
Okay. So I think for the next question would be back to Miss Lindsay again. We would like to hear more maybe about the efforts that has been done to optimize that tobacco tax policy in Philippines. You mentioned before there are an increasing trend after the sin tax policy is implied. Maybe you want to share more about that. We would like to hear about the sin tax in Philippines.
So the Philippine government in 2019 passed Republic Act 11346, increasing the excise taxes further on tobacco products. So the approved rates are, I think start beginning January 1, 2020, an additional $0.93. Beginning in the next year, 2021, $1.03. January 1, 2022, $1.13. January 1, 2023, $1.24, and a 5% increase every year thereafter. So equivalent to Philippine peso, it's a 5 peso increase yearly. So that was the approved rate in 2019. So the Sin Tax Law of 2019, this was the next reform since the 2012 Sin Tax Law was signed into law or was legislated. So in the year 2019, we had this policy window or opportunity to advocate for higher sin taxes, as the Philippines has also recently passed the Universal Healthcare Law in 2018, which would also demand additional funding or additional revenue to support its implementation. So we have seen this opportunity to legislate or to advocate for another round of increase in sin taxes. First, since we've also, based on different surveys, we've noticed that the smoking prevalence in the country has already been plateaued, or it's not decreasing, or it's not increasing anymore. So we could associate this that the excise taxes we have imposed back in 2012 is not that effective, since the prices of the cigarettes may have been more affordable to the people. Hence, the smoking prevalence have already plateaued. And second reason is, with the passage of the Universal Healthcare Law, we will be needing an additional money or revenue to support its implementation. And since 2012, since we had the sin tax law, it has already been a practice that the revenues that we got from the tobacco tax are being put to health, or being allotted to finance different healthcare programs, one of which is the National Health Insurance Program coverage, which mainly benefits the poor or the indigent people. So we are very fortunate that we have very supportive legislators and civil society organizations, of course, the medical societies, who help the department in advocating or lobbying for the increase in sin taxes. And of course, these are all backed up with scientific evidence and all your health-related arguments to really push for as much increase in the rates of the sin taxes. So that was the very, very quick story on how we were able to legislate another round of increase in excise taxes in the country.
So you're saying that in Philippines right now, there's already a roadmap for a tax increase?
Yes.
Or is it just decide like annually, like every year? Or because from you're saying what I'm getting is there's already a roadmap that like in 2020 it will increase this much, and next year it will increase that much.
Yes, just like the tax rates in Syntax 2012, which there is annual increase in the tax rates of the excise tax. Same goes with this new law. Beginning 2020, we have an additional 5 pesos, 2021 additional 5 pesos. So until the year that we decided again to increase the excise taxes. So that has already been legislated.
Wonderful. So it's actually decided in like one regulation, but it will be implemented throughout like how many years? 3, 5 years?
2023, yes.
23.
4 to 5 years.
4, okay. Yeah.
But of course, amendments to the law are always open whenever there are chances to amend the current tax rates, and the Philippine Department of Health and of course the Department of Finance are always open to support these kinds of legislations, amending of course for even higher excise tax rates.
Yeah. And the legislation is a product from the Ministry of Finance, or is it a product from the House Representative?
We have champions both from the House of Representatives and from the Senate. We have undergone several deliberations to reconcile the rates proposed by the House of Representatives and the Senate until we were able to come up with a quite reasonable rates for both the Department of Health and the Department of Finance. But of course, we have been advocating for even higher rates. I think that time, if I remember correctly, we wanted to have an at least 60 pesos increase in the first year, corresponding to with an additional 9% increase every year thereafter. So we may not able to get the proposed or the ideal rate that we want, which is the 60 pesos. I think that's about that is about additional 1.3 US dollars, with an average increase of 9% every year. So I think it's still the rates that we have now. It's still a win for health, and of course to further deter smoking in the country, and for the additional revenues that we will be getting to fund and support the implementation of the universal healthcare. But of course, as whenever we have the opportunity to support and lobby different proposals, increasing the excise taxes and other tobacco control initiatives, we will be definitely supporting those.
Okay, and I think you also mentioned that in the beginning of the syntax reform, the tax policy in Philippines now has become, the structure of the tax has become a unified structure.
Yes.
Yes. So before it was more complex.
Two-tiered. I think two-tiered. Before syntax 2012, we have a two-tiered structure, which made it I think difficult to enforce and regulate. But I think that's one of the milestones, or one of the biggest reform included in the syntax of 2012, making the tax structure unified. So we all impose the same excise tax on even less or premium brands of cigarettes.
Okay, so that already implemented in 2012
yes.
to unify the tax structure, and now the effort is just to increase the tobacco tax every year. Okay.
So we have to adjust to we also have to adjust to the increasing purchasing power of the youth, of the middle upper class, and all the other consumers. So yes.
But all the policy, all the increase will apply to all brands of cigarette brands, no matter like how big is the brand, or like how many shares they have in the market.
Yes, it's a unified structure already.
It's a unified structure. Wonderful, wonderful. We would like to hear more about, I mean, like, this is a great achievement for Philippines. We also in Indonesia use the Philippine case as a case study for the syntax reform. But I'm sure there's a lot of challenges behind that. So we want to hear that after this. I want to hear more about Sri Lanka first. So Ms. Sasanka, what are the efforts that's been done by your organizations or other tobacco control organizations in Sri Lanka to optimize the tobacco tax policy there?
Yes. In Sri Lanka and through the ADIC, we mainly empower people to understand the need of these taxes and prices of the cigarettes, and we empower people to pressure government for to increase these tobacco tax. As an example, we have youth groups in all around the countries and community members like that. Then we every day and every time we are discuss with the these needs. What is the need for these tobacco taxes? We talk about the people. We are talking about the people regarding this tax. What are the needs? Why are we need proper prices for the tobacco tax like that? Then every year, in Sri Lanka we have in month of May in Parliament, the Ministry of Finance present the budget of Sri Lanka. Then every year the Minister of Finance speak about and talk about these tobacco taxes. In Sri Lanka, we have a excise tax and value-added taxes for the tobacco. Then we lobby finance minister, and we discuss about what are the needs for why we need for tobacco taxes in Sri Lanka. Apart from that, in Sri Lanka per day 60 people died because of tobacco. Then because of that, we are mainly focused on the tobacco taxes and prices, and we send in letters for the president and prime minister and the finance minister for empower them to increase tobacco taxes in Sri Lanka, and also we are conducting some picketings and social media campaigns like that. Those are the main things we are doing for the increased tobacco tax in Sri Lanka.
Wonderful. So, what would you say? What is the result after like years of advocacy? Do you see any significant increase for the tobacco tax in Sri Lanka?
Yeah, in every year. Sorry, today I get the questions all of these. Then I didn't get the correct data for this. That in every year, according to the budget, we increased our prices in cigarettes. But as I said, some brands, the tobacco company doesn't increase the prices in tobacco tax. They pay their own money for those taxes.
Yeah, so despite of the tobacco tax policy, the cigarette price in the market remained the same. So they kind of subsidize for the tobacco tax. That's what happens also, I think, in many countries. Yes. And when we talk also about the tax structure in Sri Lanka, would you like to also share what is the tax structure in there? Is it a unified structure or it's also a complex structure?
It's a very complex structure, and now I don't have a proper data for the present. Now I get the question.
Okay. So it's also similar like in Indonesia with a complex structure, but I think Mr. Febri from the Ministry of Finance in Indonesia also shared in the chat room that actually in Sri Lanka the tobacco tax is 66% from the retail price in average, which is, I think it's still the highest compared to Philippines or Indonesia currently. So I think I would also hear from Ms. Sasanka. So what do you think it's the challenges to make cigarette less affordable in there? You said that you can still buy it per stick, right? Not just per pack. Yeah. And is there any challenge, because you don't have promotion and advertising anymore? That's a different situation than Indonesia, but what are the other challenges to make a cigarette less affordable or accessible at least?
Yes, in Sri Lanka currently in this year we got a new government. Then in this year we are planning to implement stop selling single cigarettes, and now currently we have 80% pictorial health warnings in cigarette packets, and we are trying to stop selling cigarettes near schools in 1 kilometer area. Then those are the main implementations we are trying to implement in Sri Lanka currently. And in current situation in Sri Lanka, in Sri Lanka and the whole world, tobacco consumptions are going down. In current situation, tobacco industry trying to promote cannabis in Sri Lanka and in social media and among young people. In these days, we have a big talk about the cannabis legalization. We know the tobacco industry is behind these campaigns, and every time they are trying to talk about the good effects and what are the positive things to use cannabis like that. And in these days, we are trying to counterattack those things also. And as tobacco, those are the main things we have to empower president and the Minister of Finance to increase our tobacco tax according to our scientific method. And also we are trying to stop single cigarettes and increase plain packaging for the cigarette packets. Those are the main things we are working on these days.
Okay, so the advocacy efforts now, it's not just the pictorial health warning, but also plain packaging in
Yes.
Sri Lanka, you're saying. And you're saying that the tobacco consumption is already going down?
Yes, in Corona period, it's going, I think, 40% consumption is going down.
Okay, so that's a huge reduce. I think I'm not sure the tobacco industry would be happy about that. So the focus is now again plain packaging, and then the stop selling cigarette per stick.
Yes.
Yes. Okay. And for Philippines, Ms. Lindsay, what are the challenges behind all the achievements in the syntax policy? Maybe you want to share briefly the fight throughout the years.
I think same with SAS, that one of the challenges in the country is that cigarettes are still sold per stick, which is very hard, I think, to lobby or to regulate at the same time, since cigarettes are usually sold per stick in sari-sari stores or in very, very small town stores or barangay stores, sold by street vendors. So the selling per stick is still really makes it accessible, especially to the younger people. So whenever you have coins just lying around there, and you can easily buy even a stick of cigarette. And I think another challenge is that tobacco companies or the tobacco industry is still really aggressive in terms of promoting their products, and I think they have always been into suing or into suing the government because of the different tobacco control regulations or actions that we have been doing to protect or to protect the health of the Filipino people, especially the young ones. And I think another challenge is that novel tobacco products have been really rampant or rapidly being available in the Philippines, like the e-cig, HTPs, and the like. But we are also fortunate to have another law legislated imposing taxes on these products and regulating the use of cigarettes and other tobacco products. So the country is definitely very lucky to have supportive civil society organizations, medical societies, even the national government agencies who has been with the Philippines all throughout this reform, supporting us and giving us the necessary technical assistance and recommendations in order to provide science-based recommended policies. So I think that's it. But as because of these challenges, we are continuing to review and assess our tobacco control strategies and policies in order to further improve the tobacco control initiatives in the country.
Okay, so I think the last question maybe, what is the further actions that Philippines is taking to make cigarette less affordable, since you already have the syntax and the roadmap to increase tax? Is there any other strategy that the government is planning to have in the near future?
Mm-hmm. I think the Philippines has already made great strides in terms of legislating and implementing different tobacco control initiatives, from monitoring tobacco use and prevention policies, regulating the sale, warning about the dangers of tobacco, enforcing ban on public smoking, designating specific areas for smoking. And I think what we are strengthening now is the response at the local level, and really making all the national policies implementable by the local government units. So I think that's one of the most important thing that we are advocating now is really putting forward or strengthening the response or the tobacco control policies or the implementation at your local government units, so that monitoring and implementation could be easily implemented. So I think we've also the Health Promotion Bureau of the Department of Health, or the Health Promotion and Communication Service Bureau, is really also actively pushing the No Smoking is the New Normal campaign, especially in this time of the pandemic, that some study shows that smokers are really more vulnerable in might be more vulnerable in contracting COVID-19, and also to protect them from tobacco-related diseases. So I think we've been really been active in different activities, health promotion activities, in terms of making people or helping people understand the dangers and the impacts of smoking to all population. And we've also, I think there are several researches or strategies in the pipeline to review the current the effectiveness of the current tobacco control strategies. For example, we've been partnering with several academic institutions, for example, to review the impact of the effectiveness of the graphic and the packaging. So we have also those kinds of initiatives.
Wonderful, wonderful. Thank you so much, Ms. Lindsay. Maybe if any of the participants here have further questions for Ms. Lindsay or Ms. Sasanka, please write your questions in the chat box, and I will try to ask the questions to our speakers at the end of these sessions. So I think now we would like to hear more from the officials from the Ministry of Finance in Indonesia. Pak Febri, would you like to share some presentation?
Yes, please. Can I get the share screen access?
Yes. We will share you as the co-host. Okay. So, Pak Febri, we would like to hear your sharings about the great efforts and, of course, the challenging efforts that has been made to make cigarette less affordable in Indonesia. Thank you. The floor is yours.
Okay, thank you. Good afternoon, everyone. Thank you for Chisdi for arranging this meeting, and I'm really happy to be here and join the discussion with you all. And my name is Febri Pangestu. I'm a policy analyst. I'm working for the Minister of Finance. And currently I do the analysis for tax increase for tobacco in Indonesia. So here I want to show you the tobacco excise policy in recent decade. And our Indonesian excise policy has been aimed and consistently at the consumption control and revenue optimization. So it has been a challenge for the government to administer an effective tobacco policy to ensure the optimal level and structure of taxation to achieve both the public health and public finance objectives. So here we know that our tax policy should not be made only based on health consideration, but also stem on the economic grounds. And as Mbak Nurul mentioned before, that the political and economic consideration have added complexity to determining effective excise tax structure and rates. And so there's no one-size-fits-all approach, and the government do take a careful consideration towards the best practice policy into our excise policy reform. Okay, so here's our main concern about the smoking prevalence in Indonesia. And we know, if you see from 2013 to 2018, for adult smoking prevalence decline, although we know that the number of adult male smoker remains quite high, as of 62.9%. And if we look at the smoking prevalence age 10 to 18 years old, we can see that the number has increased in several years. And the figure is almost twice the target in 2019. So the government really have the tough job to lessen the smoking prevalence for child and teenage. Okay, so here's the dynamics of excise policy in Indonesia, and we do have several reforms. The first is we have changed the excise tax system from the ad valorem into a specific system. And we know that for consumption control, for tobacco consumption control, a specific tax system is preferred because it will push the price higher and leave small space for the producer to play the price. And we also have streamlined the excise structure from 19 tiers in 2009 to 10 tiers in 2019. And as Mbak Nurul has said also, that the government has tried to increase the tariff as well as the minimum retail price for 2020. And we also increased the law enforcement for illegal cigarette in Indonesia, and the number has dropped from 7% in 2018 to 3% in 2019. So it's an improvement. Okay, this is the tobacco excise and minimum retail price policy for 2020. And you know, although we know that the minimum retail price at average increased by 35%, but if you look at the in each tier, especially for the machine-made cigarettes, the retail price increase is actually higher. For the class 1 machine-made closed cigarette, the retail price increased by 52%. And in the white cigarette, machine-made white cigarette, it increased by 58%. So it's actually a huge leap from of what the government have made in the recent years. Usually we just determine the tax rate, but we feel that only tobacco excise rate is not enough to push the price higher. So for 2020, we also adjust the minimum retail price and we set the increase even higher than the tax rate increase. And for the other tobacco products, we still use the ad valorem system because it was introduced in mid 2018, so it's relatively new, and we are considering to convert the tax rate from ad valorem rate to a specific rate in the future. So what have the government achieved in recent years? We see that the affordability index has increased. So this graph is made to compare the price year to year from 2018 to 2013 to 2020. So if we look at the graph, as the index increase, meaning the cigarette price became more expensive. Except in 2019, cigarette prices relatively cheaper towards income because there's no increase in excise rates. So this graph shows that the tax rate does can play an important role in pushing the cigarette price up and higher. And if we look at the graph on the right side, this is the production, the cigarette production from 2013 to 2020 in billion sticks. And you can see that the growth has been negative, except for 2019 because there's no tax increase. But if we look at the 2020 estimation, we can see that due to the high tariff increase and as well as the COVID-19 impact, the cigarette production is predicted to decline by 16.3% in 2020. So in 7 years, we can see that the trajectory is on the right track, I think. And the Ministry of Finance has also made a comparison with the Southeast Asian countries. And actually, the cigarette price in Indonesia is not really bad if you compare to neighboring countries such as Thailand, Timor-Leste, Vietnam, or even the Philippines. You can see that Indonesia, as well as Philippines, Bangladesh, and also Sri Lanka have increasing trends. So we know that these countries, the excise policy has been in the right track to make the cigarette price even less affordable. And if we look at the tax burden, if we compare to the average, the world's average, the cigarette price in Indonesia is actually a little bit higher than the world average, and even higher than the upper middle income countries, lower middle income countries, and the low income countries. But yeah, still lower than the average price of high income countries. But for the total tax burden, it achieved about 63.5%, and it is really close to the average of tax burden in high-income countries, and absolutely still higher than the other income group. So what I'm saying that the government has always want to make the cigarette price less affordable to tackle the smoking prevalence, especially for the child and teenager smokers. And I think looking at these figures that our tobacco excise policy is on the right track. I think that's all that I can share with you, and I'm really happy to have a more deeper discussion. Thank you, Mbak Nurul.
Thank you, Pak Febri. Thank you so much for the sharing. That's very insightful. So now we will continue to the Q&A session. We already have one question in the chat box. So any of you who would like to raise a question, you may also raise your hand and ask it directly. If not, you may just write down in the chat box. I will try to accommodate as much question as possible, but we would be considering time for the Q&A session. So I think for the first question, it will go to Ms. Sasanka and also Ms. Lindsay. What kind of campaign or innovative program is currently being implemented in your country that you consider impactful to raise awareness among citizens that related to making tobacco price less affordable? Maybe Mrs. Sanka, you want to answer the question first? Sorry, you're still on mute. Yes.
Now here.
Thank you. Yes.
Okay. First of all, I have to tell, you know, tobacco industry targeting young people. Then we also mainly target young people to prevent tobacco, alcohol, and other drugs. And apart from the tobacco tax and other policies, we always trying to minimize the tobacco image among young people, because tobacco industry very effectively and very youth-friendly way, very attractive way, they promote their products for the young people. Because of that, young people also think this tobacco is a very, very funky and very, very useful and that kind of product. Then in ADIC, and I'm mainly working with the young people, and we have an island-wide youth network, around 6,000 young members in our youth network, Youth Action Network. I send the ADIC and Yan Sri Lanka Facebook page links with our chat. Then you can go through and check what kind of campaigns and trainings we conduct for the young people and others. For the taxation, as I said, in Sri Lanka, we have 25 districts. Then all these districts, we have young youth groups in island-wide. Then in the month of May, in budget time, we are discussed with the young people and we organize general campaign to empower the persons who responsible for the tobacco taxation and kind of those policies. Then we conducting some kind of poster campaigns in every district, and we shared some kind of social media posts, videos, and data regarding the tobacco taxation and what are the need and what are the limitations we have regarding tobacco tax in Sri Lanka. And as I said, we lobby ministers and the persons who are responsible for these rules and regulations. And mainly, we empower the Ministry of Health, because he has the power to implement these rules, and he has the power to empower President or Minister of Finance to regulate these implementations like that. Then we closely working with the Minister of Health and Minister of the Health to raise the tax and prices in Sri Lanka. Those are the main things we are conducting regarding these prices and taxation.
Thank you, Mrs. Sanka. Maybe Ms. Lindsay would like to add what are the innovative campaign that has been made or efforts in Philippines. Hello, Ms. Lindsay.
Units and the regional.
Sorry, you're still on mute, I think. Or innovative program is currently being implemented in your country that you consider impactful to raise awareness among citizens that related to.
Hello?
Hello, yes.
Sorry, I had difficulty in my internet connection, but can everyone hear me?
Yes, we can hear you now.
Okay. So in terms of the different activities for the or interventions for our campaigns that we have been doing with the local government units and different regional health offices in the country, we have this so-called the brief tobacco intervention training, or the BTI training, which seeks to capacitate the frontline health service providers in delivering effective brief advice or assistance for smokers to quit smoking, and also to promote and advocate smoking cessation in the Philippines. So we also conduct different advocacies, such as the celebration of the World No Tobacco Day or the No Smoking Month. And we also have this so-called Red Orchid monitoring or validation awarding. This is to recognize the efforts of the local government units or different government hospitals, different government offices in their comprehensive efforts in implementing the 100% tobacco-free environment. So if I'm not mistaken, this is a yearly awarding or yearly ceremony recognizing the efforts of local government units, government offices in the different tobacco control initiatives that have been implementing. Also, we have different media advocacies and IEC materials being distributed in offices, in schools, to, of course, instill awareness among the targeted audience on the prohibition of smoking in public places, including other health programs. So in 2019, I think, or 2018, we have this Yossi Kadiri campaign. We have Yossi Kadiri. Yossi Kadiri is our mascot. He's like a very dirty, very ugly mascot. He's a cigarette, and we developed this commercial or audio visual campaign with Manny Pacquiao, if you all know him, the boxer. Yes, I can share the link of the video.
Yeah, you can share it in the chat
so
box.
That you can watch the campaign that we had. So basically, the idea of that campaign is we use this to lobby for higher sin taxes back in 2018 and 2019. So I can share with you the
link.
video
Yes.
here. So basically, we asked the help of a world-renowned boxer in promoting or advocating for even higher taxes. So it is the help of public figures or artists or whoever to support your campaign is really helpful in pushing for advocacies like this.
Okay. So yeah, so there's public figure as a champion for tobacco tax campaign. That's very interesting. I think the second and third question I might just ask at the same time. Is there any other parties or organizations or communities that are against Philippines on raising tobacco tax, other than of course, the tobacco industry by nature? because it seems that the CSO and the government's already on the same page. Is there any other, do you see any other organizations or communities that are protesting again the tobacco tax increase?
I think it's this is also normal. Definitely normal to have an opposition.
Yes.
Whenever you are advocating for something, especially in the Congress. So I think there will, as I have said a while ago, there are always opposition. During the time that we have been advocating for the increase in excise taxes, I think the groups of farm or groups representing the tobacco farmers are one of those against the increase in tobacco excise tax because part of the revenue that we are getting from the tobacco excise tax are being provided to tobacco farmers, to the LGUs or to the LGU producing tobacco. So I think it would mean that I think the usual argument being raised is that increasing, of course, when you increase the excise taxes of these products, less people would buy the products, and it would mean lesser revenue for the government. So I think that's one of the challenges or the opposing views when we were advocating for the increase in the excise taxes. But eventually, we have really received support from different organizations and the government as well. So I think it's just really normal to have several groups representing or fighting for their own interest, especially when it comes to these kinds of issues.
Yeah. Of course, I think every policy would have opposition as its own nature. And in Philippines itself, is there any ceiling for tobacco tax percentage compared to the retail price? Like for example, like in Indonesia, we have a maximum of 57%. Do you have a similar policy like that as well?
I think currently we have no ceiling yet.
Okay. So there's no a maximum amount of tobacco tax compared to retail price in Philippines. Okay, thank you, Ms. Lindsay. How about in Sri Lanka, Ms. Sasanka? Is there a similar policy like in Indonesia as well for the tobacco tax policy ceiling? Sorry, you're still on mute. Yes.
Sorry, I didn't get that question.
Yes. So is that a policy in Sri Lanka that put a ceiling for a tobacco tax policy, like the maximum tobacco tax policy compared to the retail price?
I think we have a policy. As I said, I don't know correctly. Is there any policy like that? I think we have policy. After that, then I can search and send it those policies and regard what kind of method we have to put taxes in according to tobacco.
Okay, thank you. That will be great, Ms. Sasanka. And there's a question to Mr. Febri. Tobacco excise is meant to be for consumption control. But is there a target for smoking consumption reduction? as part of the indicator of the tobacco tax policy implementation in Indonesia?
I think, yes, there is a target to reduce the smoking prevalence for child and teenagers in the Indonesian medium-term development plan, 2020 to 2024, to increase, to decrease from 9.1% to 8.7%, right?
Yeah.
And yeah, but you know that smoking prevalence reduction is not a single ministry work. It has to be really good cooperation between the Ministry of Finance and the Minister of Health and the other line ministries. So it's not a single work. And just to probably to, to respond to the, is there any tax rate ceiling in the other country? I have searched literatures and international practices in other countries, and as far as I know, that there's no other country than Indonesia that have the ceiling tax rate for tobacco. That's a bit strange. And you know, our excise law is one of the challenge in the tobacco excise policy, including the ceiling tax rate and how we have to listen to the tobacco industries and so on. So probably if there's a plan of the government to amend the excise law, those topics will be our priority to discuss and analyze.
Yeah. Thank you, Mr. Febri. I think the unique situation of the tobacco tax law in Indonesia creates another complications even for the government itself.
Yeah, and if we compare to the Philippines, for example, I also have taken a look at the Philippine case, how they established the unified approach for the tobacco excise policy. But actually, if we want to adopt that such kind of policy, it will be very difficult because we have different complexity. For example, like in the Philippines, correct me if I'm wrong, Lindsay, there are a few cigarette producer in Philippines, and most of them are affiliated to Philip Morris International, probably 80 to 90%. So it's close to the monopolistic competition. But in Indonesia, we have so many big players, and if we talk about the total producer, we have like about 500 to 600 producer in Indonesia. And if we take a look at the product in the Philippines, is more like they have like the same product, the white cigarette, but we have clove cigarette, the white cigarette, and both in machine made and the hand rolled ones. So it's actually at the difficulty for the government to determine the optimal tax rate for each tier, and it's not really an easy job to unify the tax structure. But as you know, as I mentioned, that we actually has decreased the 19 tiers to 10 tiers this year.
Thank you, Mr. Febri. I think it really provides another interesting insights about the situation, the unique situation in each country, and especially in Indonesia. Maybe Miss Lindsay, you would like to address Mr. Febri questions about the type of cigarette producers in Philippines.
Yes, Mr. Febri is correct. Compared to other countries, we have very few players here in the Philippines. and we only have this really very few type of cigarettes, so which made the country easy to regulate or to have a unified scheme of taxation. And really the other known tobacco companies or tobacco companies in the country could also be affiliated to Philip Morris, which is known as the one of the biggest tobacco players. So I think that's one of the advantage somehow why we were able to shift from a two-tiered taxation scheme to a unified taxation scheme.
Yeah, thank you, Ms. Lindsay, for the clarifications.
Thank you.
And I think we have a questions about smoking policy during this COVID pandemic. So I think the question would be, the first question is there any changes in smoking behavior that the country observes during this COVID pandemic? And the second question is there a new tobacco control policy, either tax related or not, that would be, that is planned to be implemented in response to the current pandemic? Maybe Miss Lindsay, you would like to address the questions?
Hi, Bella. Okay. I think we haven't had any recent survey or means to measure the changes in behavior in terms of smoking in our country's population in times of this COVID pandemic, but definitely the lockdown helped in keeping people from doing unnecessary activities such as smoking. And we have also implemented we have a long-standing policy also banning the smoking in public. So I guess at this time of the pandemic, that policy has just been reinforced better, especially in the local government units. And for the second question, if there are any new tobacco control policy, either tax related or not, specifically to respond to the current pandemic, there is no current policy or a new tobacco tax policy for specific for this pandemic. As I have mentioned a while ago, we just had to really strengthen the implementation of our policies at the local government units. So we have also been advocating for no smoking is the new normal campaign here in the Philippines, here in the Department of Health, and have always reminded different national government agencies, different establishments, public and private establishments, that at this time of the pandemic, we really have to be wary of our the different behaviors that might contribute to making the public more vulnerable or more vulnerable to the virus. So as we also advance or develop policies, COVID-19 policies, especially concerning other national government agencies or other industries, we have always reminded them of the minimum public health standards, which includes the no smoking or drinking, especially in public places, and of course to consider implementing all other national tobacco control policies to have them to have a strong implementation at the local government.
Thank you, Ms. Lindsay. Ms. Sasanka, maybe you want to share. You already said something about a reduce of 40% consumption. Maybe you want to elaborate more what has been done for such things to happen.
Yes, there is the WHO and UN mentioned there is a major risk, corona risk for the smokers. We promote that among people, there is a major risk for the smokers to this COVID. And also in this period, the people cannot buy cigarettes because there is no any shops and like that. Then the availability is very low in this period. And also the people doesn't have the people can't go to their jobs, and most of workers and laborers doesn't have any job, and they don't have any salary in those months. Because of that, their affordability limit also very low. I think those are the main risk in these periods for the minimize the tobacco usage in this period. People are using social media. We use this social media to prevent tobacco in this period. We mainly promote tobacco is a main risk factors to corona. And if you stop using tobacco in this period, then you can continue this practice for further. Because in some people tell the smoking is very difficult to stop their behaviors like that. But we promote, if you stop smoking in this COVID period, then you can continue this good behavior for the further. These are the main campaigns we conduct in this COVID period, the social media.
Thank you. Thank you, Ms. Sasanka. Maybe Mr. Febri, would you like also to share if there's any changes in consideration in making a policy for tobacco excise tax during the pandemic era?
Actually, there's no specific excise policy during the pandemic, but I don't know. It's just my word. It's a kind of a blessing in disguise with the impact of COVID-19 pandemic. But we also look at the cigarette production have declined deeper more than we predicted. Without COVID-19 pandemic, we estimated that the cigarette production will fall for about 11% in 2020 due to the high tax rates increase and as well as the minimum retail price. But after we evaluate the from the industry, from the cigarette prices in from June 2020, we predict that the cigarette production will fall deeper than 11%, which is we estimated for about 16.3%. So it's yeah, I said it's blessing in disguise. It's not to be rude about the COVID-19 victims, but in terms of cigarette consumption, I think we are glad that the cigarette production decreased in 2020.
Okay. Thank you so much, Mr. Febri. And I think that will also close our discussions for today. So I think some points that I would like to highlight from our discussion. It's been almost 2 hours. Discussion is very insightful. So I think all countries aim to make cigarette price up and to make them less affordable. And that is by making the structure as simple as possible and increase the tax tariff higher than the purchasing power. I think all countries' efforts are going toward that way. And the challenges remain. And I think from the discussions, we see that even our neighbor countries also shared similar problems about selling cigarette by sticks from the small retailers, and issue about the promotion and advertising of the cigarette product itself, and also opposition efforts, not just from tobacco industry, but also from other groups, including the farmer groups. And it takes collective efforts, not only from the tobacco tax policy, but from other tobacco control policy, to control the supply and demand sides, to again reduce the consumption of cigarette, especially for the youth and also the vulnerable populations. And I think another highlights that we also discussed today is that each country has its unique situation and its complexity, and also have its opportunities to enforce the optimum tobacco tax policy. So I think that's all the highlights and the takeaways from our discussions. Again, I would like to thank our speakers. Thank you for the sharings and for the time. It's been very insightful, and also for all the participants for this evening. It's been great to have a reunion with the youth campaign participants today, and have great questions. And I think after this, we would like to invite you to have a tweet bomb. We will share what is a tweet bomb here. So maybe if all of you, if you're active in Twitter, we can tweet together with this template. You can just write this down: hello, my name, and put where you're from, and show support for the Minister of Finance in Indonesia to increase tobacco excise and to reduce the affordability of cigarette in Indonesia further. Because I don't know what Mr. Febri said, like the production this year during pandemic, it's reduced more than estimated. Hopefully it won't reduce the tax increase this year from the Ministry of Finance as well. So let's support the Ministry of Finance. We hope that the great efforts can continue to optimize and maximize the tobacco excise increase in Indonesia this year. So if you can help and tweet, and also if any of you would like to share this discussion to your other colleagues, it's been a great discussion. You can share the YouTube video. Maybe we will also share the link again at the bottom, because some of the participants have not joined when we share the YouTube link in the beginning. I think it's here. Yes. Yeah, the YouTube link is there. So if you want to share, you can use the link. And also, if you can also help to tweet to support the Minister of Finance of Indonesia to increase tobacco tax, you can help use the template and the hashtags. Thank you so much. I hope to see everyone again soon enough. And I wish you all in a good health during this hard time in pandemic. Hope everyone in the region is in a healthy condition, in a safe position, even though that it might take some times that we meet again. Maybe some of us should meet in Thailand this September, but now it's postponed because of the pandemics. So stay safe, everyone, and see you again in the next opportunity for youth reunion for tobacco control in Asia Pacific. Thank you so much.
Thank you so much. Thank you, CISD, to organize this event and invite us.
Thank you so much. Thank you,
Okay.
Sasanka. Thank you, Ms. Lindsay. Thank you, Pa Febri. Thank you so much.
Thank you again for
Malu.
inviting
Thank you, Sasanka, Lindsay, and Chisti. See you.
See you. Bye.
In Indonesia, cigarette price is cheap and affordable for vulnerable groups such as children and unfortunate families. A survey from Center for Social Security Studies, School of Graduate University of Indonesia implied that 74% of smokers plan to quit smoking if the cigarette price is increasing to 70,000 rupiahs or equal to $4.75. Annually, government has made effort to rise cigarette price. However, the rising price is still low and insignificant. TC magazine demonstrated during 2015 to 2019 the increment of cigarette price around 300 rupiahs or equal to $0.02. Unsurprisingly, 44% of families who live under regional minimum wage are able to buy cigarettes. In 2020, Statistics Indonesia found the second biggest expenditure after rice within unfortunate family is cigarette. The slow increment of cigarette price in Indonesia also is a result of different opinions among ministries and policymakers. Some ministries supported the increment of cigarette price while others against it. This phenomenon is well depicted in TC magazine. Finally, it all impacted on how the Ministry of Finance as policy and decision maker of tobacco excise take the initiative action towards this issue. So this is it. Virtual coffee sharing with APACT Youth Camp 2018 alumni, counting down to the tobacco excise renewal in Indonesia.